Emily and Craig Reedy are having an anxious morning. Their 8-month-old son, Ben, is back at Columbus Children's Hospital for testing. His cardiologists want to see what's happening inside Ben's heart.
They found some scar tissue on the artery, on one of the arteries that they had to correct, and it's starting to narrow, and they just want to get a better view of what's going on.
Ben's heart has been monitored by Children's since an ultrasound revealed a serious heart defect just 4 months into Emily's pregnancy. The prenatal test revealed what's called transposition of the great vessels, meaning Ben's arteries were flip-flopped. Within days of diagnosis, the Reedys met with a surgeon at Columbus Children's Heart Center to prepare for what lie ahead.
He said that if Ben did not have the surgery, Ben would not survive without the surgery. So it was a life-threatening heart condition that he had to have fixed in order to survive.
But knowing what to expect didn't erase the worry. The day Ben was born was tense. Emily saw her son just long enough to see the blue tips of his fingers and toes before a transport team rushed him to Children's.
You know, trying to tell yourself that he's going to be okay. You know, he's going to come out and he's going to get fixed and he's going to be fine just like any other normal child.
Within 12 hours of being born, Ben was in the most sophisticated heart catheterization labs in the world, located right here at Columbus Children's. Interventional cardiologist John Cheatham would perform a procedure to open a hole in Ben's heart to allow oxygenated blood to flow throughout his tiny body. This temporary measure would give Ben time to be a baby before facing major open heart surgery.
They get their temperature stability better, they have their regulation of their sugar better, they've started to eat, and that stimulates all of the good immune system that will make them tolerate whatever stressful procedure you're going to do a little bit later.
Ben would spend the next 8 days growing stronger and bonding with his mom and dad. Then it was time for Ben's open heart surgery. The procedure to switch his arteries was expected to take 5 hours. Instead, it would last almost 15. Complications made for an even more complex recovery.
Right now, he needs to take a really big nap, is how he explained it. So his heart was bruised, very bruised. So from then on, he was put on a life machine.
Dr. Feltus would spend the next 24 hours at Ben's bedside.
I vividly remember the night that Ben had his surgery. As a cardiac intensivist, I often spend the first night after surgery with the child. And it was an anxious time. He was on support on a variety of medications, but Ben's family was well prepared for it. We spent the night together, and his heart gradually strengthened over the course of the next several days. So he was able to come off of the support.
And next thing you know, Ben was just coming around. He was waking up. The swelling on his body was starting to go away. And it was like one thing after another. The little boy that we'd given birth to was coming back to what he looked like.
To make sure Ben keeps on growing in health and size, doctors want to see just how his heart is healing.
Kisses all around, here we go. Mwah. You guys can just sit tight. He may cry with the mask a little bit. Don't be alarmed. Come. Come. See, Mommy will be back. And Daddy, 5 minutes. Come on, let's go.
That's why at 8 months, Ben's back at Children's for a CT scan and heart echo. The procedure done under anesthesia will provide the best picture.
Okay, so what we've done is use the data from the CT scan to create a 3D picture of this patient's aorta and pulmonary arteries so that the surgeons and the cardiologists can get some measurements of some narrowing that has occurred after the operation and may need to be corrected to improve the blood flow to the lungs or to the rest of the body.
These tests revealed a potential problem with scar tissue formed after his surgery. So Ben underwent a second heart catheterization procedure to keep his arteries open and the blood flowing normally. His parents know this probably won't be Ben's last visit to Children's, but they wouldn't want it any other way.
He's a miracle. He is. Ben would not be here if it hadn't been for this hospital. Ben would not be here if it hadn't been for the care that he received by the doctors. I don't believe in my heart if he would have been anywhere else that he would not be here today. The doctors did exactly what they had to do. They saved his life.